Have you ever been to your dentist and they told you need root canal treatment? Is it painful? Let's dive deep into that. Today we're diving into one of the most feared but least understood procedures in dentistry, root canal treatment. Let's talk about it. Why root canals have such a bad reputation. The fear of root canals is almost cultural. People used, I'd rather get a root canal treatment as a joke or something that sounds miserable. But here's the truth. Pain people fear is the pain of infection, not the treatment. An inflamed pulp or infected nerve sends intense and very strong signals that get transported to the brain, and they're throbbing, they're sharp, they radiate, they can actually transfer from one jaw to the other, and they feel unbearable sometimes. They can take a person to the emergency room. So modern root canal treatment is what is done to get person out of pain. It's highly effective. If it's done under local anesthetic, most of the time that's how it's done, and with advanced imaging, that procedure can be painless. The procedure itself is typically comfortable as getting a regular filling. So the reputation is outdated, left over from decades ago, before modern techniques and microscopes and numbing agents existed. We've got a much more comfortable procedure right now, and that's where dentistry is heading. Segment 2, what a root canal treatment actually is. Let's simplify the biology. Inside every tooth, there is a soft tissue center called the pulp. That pulp has nerve endings, it has blood vessels, and it's protected by the enamel and the dent. That's the outside layer of the tooth. When bacteria from a deep cavity or a crack reaches inside the tooth, the pulp becomes infected. That infection creates pressure, inflammation, and pain. A root canal treatment is essentially this. We remove the infected tissue, we clean the inside of the tooth, and then we disinfect it and seal it while keeping its outer layer, the natural tooth, in place. So the enamel and the dentin remain there with the roots, and the inside part of the tooth gets removed or cleaned out and filled with the filling material. Your body doesn't need the pulp once the tooth is developed. It acts more like an alarm system to just let you know that something is wrong, and the surrounding tissue continue to nourish that area. This means that removing infected pulp doesn't weaken the tooth. Leaving the infection inside the tooth, however, does. It can cause bone loss around the root. It can cause reduction in tooth structure if left for a long time, a process called resorption. Think of it like removing a rotten seed from a otherwise healthy fruit. The outside structure stays intact and the infection is gone. Segment 3, what happens during the procedure? Here's a step-by-step. So we complete the numbing. This is the part where most patients are surprised by. Once numb, you shouldn't feel pain during the procedure. And then isolation with the rubber dam. So it's a little rubber blanket, I call it, and it covers around the tooth, prevents bacteria from getting inside the tooth, and prevents bacteria from getting out, or disinfectants from getting out. So we use different disinfectants, and there's no need for anyone to taste those disinfectants. Then a little tiny hole is made in the tooth, call it an access. It allows us to access the canals that are inside the tooth. Following that, we clean and shape the canals, or the space inside the tooth, and we do that to make sure that all the bacteria is gone or all the tissue is gone. We use microscopes when we're performing the procedure, and we use very small instruments combined with digital imaging. So we use radiographs, x-rays, to identify where we're at, how far we are, and how well we've cleaned or filled the tooth. We use different disinfectant, and during the disinfection process, we use instruments such as lasers or sound waves. Those modalities allow us to send the disinfectant into side channels so that we clean the canals really well. There are areas where we might not be able to reach with our regular instruments, so the disinfectants will push into them and clean them better. That way we're removing as much bacteria and tissue from the tooth and increasing the chances of success for the root canal treatment. Once we're done cleaning the tooth, we fill it up. We use bioceramic material, and that goes inside the tooth with another material called gutta percha. It's a thermoplastic material that melts with heat. Segment 4, myth busting. So let's clear up 3 of the most common myths in root canal treatments. Myth 1, root canals hurt. Truth, they remove the pain, they don't hurt. The actual procedure is highly controlled, and the patient is numb. The presence of infection is what hurts, not the treatment. Myth 2, it's better to pull the tooth. Truth, nothing is better than your own tooth. Extraction leads to shifting teeth, bone loss. need for implants or bridges. A root canal treatment preserves the tooth and its natural structure. So you get to keep your tooth and use it. Who doesn't like to bake the cake and eat it? Myth 3, root canals are not safe. Truth. The idea is based on century-old debunked science, which we have addressed in another podcast. So if you're interested in learning more about that, check the link below. Modern studies and major associations agree that root canal treatment is safe, effective, and has successes as high as 95% when done by specialists. Segment 5, the human side from pain to relief. So I've treated thousands of patients who've come in terrified but left relieved and happy. Usually I'll tell my patients, hey, did you see the last patient? Were they smiling? And they're like, yeah. I'm like, that's what I expect you to do when you leave. Just yesterday, a patient told me I suffered for days and root canal treatment didn't hurt at all. I was just overreacting to it. I hear similar stories all the time. Dental pain can disrupt sleep. It can destroy your concentration, your mood. A root canal treatment restores function, peace of mind. And that's the essence of endodontic. We eliminate pain, we save teeth, and we restore quality of life. Segment 6, closing. I hope this helps rewrite everything you thought you knew about root canal treatment. Dentistry today is precise. It's gentle, it's science-driven, and your natural teeth are worth protecting. Thank you for joining me on Beyond the Smile with Dr. Jauni. So if you want to dig deeper into the science and stories of oral health, make sure you like and subscribe. And if you like this video, check this other video as well. And I'll see you in our next episode. Until next time, stay informed and keep smiling.